how psychotic it is to say we need work requirements for Medicaid? The whole idea of Medicaid is this is for lower income people who can't afford healthcare on the private market. It's very hard for anybody to afford healthcare on the private market, by the way. So this is for people at the bottom rung of the economic ladder who need healthcare in order to survive. They say they want to force you to be working to get it. Well, hold on. Well, what happens when there's a recession and unemployment is like 10%, and that's not even the real unemployment rate when it's 10%. The U6 is the actual unemployment rate is probably closer to like 20, 25%, right? What happens in like an economic downturn when everybody loses their jobs through no fault of their own? Like the implication here is if you're not working, you're a lazy parasitic bum and you need to get your shit together. When in reality, there are massive macroeconomic factors which could lead to anybody losing their job at any given time. It's not like a personal failing. It's not a moral failing. It's like, hey, shit is kind of rough right now. I lost my job. And they're saying, if you don't have a job, fuck off. You don't get health care. So what? You're damning anybody who's poor and unemployed to not be able to get health care that they need. Do they realize how fucking insane this is? That is insane, bro. So if you look, and like, again, the assumption is you're just lazy. You're just a moocher. You're just a parasite. You just are choosing to lay on your couch and eat Cheetos and watch TV all day. And so you don't deserve your healthcare. First of all, if somebody was those things, they still deserve healthcare. Second of all, people are not those things. It's such a tiny percentage of the population that actually is like, how about I do nothing all the time forever? Because I like it that way, bro. No, everybody's trying their fucking best. It's just we live in a fucking very complex, complicated, hyper-capitalist system where a lot of people get exploited and a lot of people don't make enough money. We have working poor people who work full-time, don't make enough money to survive. You have a permanent underclass of some segment of the population is unemployed under capitalism. They use poverty as like a tool, right? They like, it, and this is what they want to do. They want to say, fuck those people. If you can't get a job, okay, you get no health care. These are from the same people, by the way, who like to pretend they're Christians. Just for the record. We love Jesus. We love his teachings. We love the Bible. If you don't have a job, fuck you. You don't deserve health care. Die. How about you die if you get sick? Overturning Biden-era rules on the program would save nearly $163 billion, and a moratorium on new taxes that states levy on providers to help finance their programs would recoup roughly 87... Oh my God. They're literally saying, hey, let's ban the states from taxing the healthcare providers. Oh my God. Oh my God. That's another giveaway to big business to do that. And they say overturning Biden-era rules. In other words, that means like stripping the extended coverage that happened under Democrats. Republicans have argued that the changes will streamline Medicaid and allow it to better focus on serving the most vulnerable beneficiaries. That is such a fucking joke. You literally have, I think it was Mike Johnson came out in an interview and he was like, able-bodied men shouldn't be getting this, bro. The able-bodied men don't deserve Medicaid. What? So if you're a young man and you're not on your parents' health care anymore and you're not making enough money to afford health care yet, Mike Johnson says, fuck you. You deserve nothing. It's literally like discrimination against young men who might happen to be unemployed because of a situation beyond their control. He says you shouldn't be allowed to get Medicaid. This is the party. Remember, this is the party that everybody says, oh, they're so great at getting the young men to come to their side, bro. Look at the demographic numbers for the voting. Look, they all love Trump, bro. Then here's the MAGA Republican Speaker of the House going, if you're a young man and you're unemployed, fuck off. You don't deserve health care. Democrats have argued the changes will lead to devastating impacts on healthcare access and have made the case, including by pointing to previous CBO estimates, that work requirements would simply remove people from coverage rather than motivate beneficiaries to find jobs. Exactly. And by the way, most of these people work anyway. Republicans are trying to say this is kind of a moderate bill. Energy and Commerce Ranking member Frank Pallone told reporters nothing could be further from the truth. All right, more on that. Medicaid recipients could face work requirements under the bill. Massive change could soon be in the works for the 71 million Americans on Medicaid, with House Republicans unveiling new legislation on Sunday that would require many enrollees in the government healthcare program to prove they are either working, volunteering, or in school to receive coverage. The proposal is part of an effort by House Republicans to find $880 billion, blah, 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 because they want to extend the 2017 tax cuts for the rich, while introducing some new reductions like eliminating taxes on tips. By the way, let me talk about this, because people are being so duped by this no taxes on tips thing. when Trump proposed that on the campaign trail, but it's like, oh, that's a great idea. He's thinking of like the service sector workers in Las Vegas and shit. That's why he did it. No. If you read the specifics of what they were proposing, they would reclassify bonuses given to CEO assholes on Wall Street. They reclassify that as it's a tip. So when they say no taxes on tips, what they mean is billionaire Wall Street CEO assholes don't have their bonuses taxed anymore. They're using it as a loophole to make the wealthy wealthier. You got to catch up. You got to catch up on the fucking tricks that these charlatans and scumbags use. Because President Trump has vowed to not touch Medicare, the health insurance program for people 65 and older, Republican lawmakers have turned their sights on Medicaid, which provides health coverage for low and middle income households. GOP lawmakers contend that Medicaid should be scrutinized because it's prone to financial waste, and that by doing so, the program will be better able to serve the people who need it. Oh, by the way, there is a lot of waste, fraud, and abuse in Medicare. It's in the privatized version, Medicare Part D. And it's on the provider end, not the consumer end. So people aren't committing fraud. The providers, the businesses, they are committing fraud. But no, they want to slash Medicaid, and they're saying there's fraud there. There's not fucking fraud. What? That poor person got a little bit too much health care. Crack down on them. How dare that poor person get too much health care? Like, what the fuck are you talking about? Where was I? Medicaid is hugely problematic because it has a lot of fraud, waste, and abuse. House Speaker Mike Johnson, a Republican from Louisiana, said in February, rooting out waste preserves the program so it's available for those who desperately need it. Again, these people, this is the same line that Elon Musk used as he was slashing pediatric cancer research, slashing Meals on Wheels, destroying the Consumer Financial Protection Bureau, which is the anti-scam police. He was going, we're just going after the waste, fraud, and abuse, bro. Slashing like malaria medication to developing countries. We're just going after waste, fraud, and abuse. Anything they don't like, they call waste, fraud, and abuse. As he takes $38 billion, by the way, in tax money, Elon does. Some policy experts and Democrats in Congress warn that slashing Medicaid would hurt many vulnerable Americans. Oh, you don't say. With millions likely to lose coverage if the bill passes, while also posing a financial risk to some hospitals that rely on the program. Nowhere in the bill are they cutting waste, fraud, and abuse. They're cutting people's health care and using that money to give tax breaks to billionaires. That's exactly right, said Frank Pallone, Democrat of New Jersey, the top Democrat on the Energy and Commerce Committee, which oversees healthcare spending. The House Republican bill could change considerably as it moves through the legislative process. More than a dozen House Republicans have told Johnson and GOP leaders they will not support cuts to the healthcare safety net programs that their constituents depend on. So when I first read that, I thought, oh my God, that's great. 12 Republicans saying I'm not going to support cuts to healthcare. However, Crystal made this point. I think she's 100% right. She's like, well, hold on. What do they mean by cuts? Because those are the kinds of people who might look at this and go, I don't view it as a cut if you have a work requirement in there. Even though it is a cut, they would go, that's not a cut. It's just a work requirement, right? So the devil's in the details. The devil's in the details. They absolutely would support some cuts, but they would just call it reforms, not a cut. So you got to be careful. I hope there actually are a dozen who would say, I can't vote for these deep cuts. But there's probably not. There's probably not. Under the House bill, many Medicaid recipients would be subject to something the measure calls a community engagement requirement. That provision would mandate the people who are enrolled in the program either work, participate in volunteer work, or be enrolled in an educational program for at least 80 hours a month. Medicaid recipients also would have to verify their community engagement eligibility twice a year. Like, this is the other thing. Republicans always talk, we got to get rid of the red tape in government, bro. We got to get rid of all the regulations and jumping through hoops. Then when it comes to life-saving social safety net programs like Medicaid, they want to put up as much red tape as possible and put as many hoops there as possible. Why? Because they don't want you getting health care. They don't believe the government should be in the business of healthcare, so they want to make it as hard as possible so that you can't get through the paperwork, you can't fucking sign up, and you don't end up getting Medicaid. That's the idea. Medicaid recipients also would have to verify their community engagement eligibility twice a year. The bill also adds a more rigorous income verification process for those who enroll in the Affordable Care Act's healthcare coverage. In other words, there are lines, right, where, you have to make under this amount in order to get Medicaid. The Democrats made that line higher, so more lower middle class people can get Medicaid. They want to lower that. They want to get rid of that. And they want more stringent income verification. So you can't just go based off your word. Hey, I make this amount of money, so I get Medicaid. You better show me your pay stubs and show me this thing and that thing. Again, more red tape, more hoops to jump through, more regulation to make it so that people don't get the health care that they need. All right, now we got to end this segment by bringing this up because this drives me crazy. I believe I saw a poll, and we may have talked about it on air, where the number in this country of the percentage of people who support any cuts to Medicaid, any cuts,